Let's learn about virginity, pregnancy, and delivery. Okay, page number 364. Okay, virginity, pregnancy, delivery. So, virginity, a virgin, very Virgo in Takta. Virgin is a female who has not experienced sexual intercourse. And defloration means loss of virginity or rupture of hymen by sexual intercourse or by masturbation. This is called defloration. Legal issues. Let's talk about legal issues. We will find some legal issues, and the question of virginity arises in case nullity of marriage. So number one, nullity of marriage, divorce. Let's mark them out. That's my pen. Okay. So, nullity of marriage, divorce, defamation, and rape. Legally, marriage is a contract between man and woman, which implies physical union by coitus. And this is marriage. This is the part of marriage. And let's talk about divorce. Divorce in Hindu Marriage Act, it means dissolution of previously valid marriage. It can be obtained on ground of adultery, bigamy, unnatural sex practices, desertion, cruelty, and in case of incurable insanity, leprosy, venereal disease. Okay. Now, what is the nullity of marriage? This is the most important part. Hindu Marriage Act, Section 12. Marriage never have to existed in law. A marriage can be nullified. Number one, when either party was under the age of marriage contract, like she does not have minimum age of marriage, and when one party was of unsound mind or mental defective at the time of marriage. Third, when one party was already validly married. Number 4, where the marriage has not been consummated due to impotence or willful refusal. 5th, where the woman was pregnant by another man at the time of the marriage. These all things is nullity of marriage. Now, genitals. Labia majora are two elongated folds of skin projecting downwards, backwards from the mons venaris. They meet in front in the anterior commissure, in back in the posterior commissure, in front of the anus. In a virgin, they are thick, firm, elastic, and rounded, and lie in the apposition so as to completely clone to the vaginal ossify. The labia majora 4 cm long, and are two thin folds of skin just within the labia majora. Labia minora are small, soft, pink, sensitive. The lower portion of the labia majora fuse to midline and form a fold called fourchette. Anteriorly, they divided to enclose clitoris and unite with each other in front and behind the clitoris to form prepuce, frenulum, respectively. Depression between fourchette at the vaginal ossify is called fossa navicularis. The clitoris is small. The vestibule is narrow. The vestibule is the triangular surface which extends from the clitoris above the anterior margin of the hymen below and laterally to the labia majora. It is usually concealed by labia. Urethral opening 2.5 cm behind the clitoris, immediately in front of the vaginal opening vulva, includes mons veneris, pad of fat lying in front of pubis, clitoris, labia majora, minora, vestibule, hymen, urethra opening. The perineum is the wedge-shaped area between the lower end of the posterior wall of the vagina and anterior anal wall. Vaginal passage is a pocket, irregular in shape. Rather than cylindrical tube, it is about 7.5 cm long, shorter on its anterior wall 6 cm, longer on posterior wall 9 cm. It collapsed to form a slit crosswise of the body. Disintended, it forms a group-shaped balloon, wider at the top and possibly lopsided because of their greater size of one lateral pocket fornix. The width at the upper end 3 to 4 cm, in nullipara 6 to 7 cm. In the Paros woman, bladder lies anteriorly, levator any muscle laterally, perineal body rectum lie posteriorly, pouch of Douglas superiorly in the vagina. The vagina is narrow, tight, mucosa is rugose, reddish in color, sensitive to touch. Its walls are approximate after frequent sexual intercourse. About 15 to 20 sexual acts, the vaginal rugi become less marked. The vagina lengthens into the posterior fornix. The full length of examining finger can be passed into the posterior fornix. The rugosity is removed only by first birth, but rarely it is absent even in a virgin. The cervical canal is nearly at the right angle to the vagina when bladder rectum are empty. In a virgin, posterior commissure fourchette are intact. With repeated injury, fourchette may become an irregular thickened scar. Fourchette is usually lacerated during childbirth. A single intercourse does not alter the parts much except rupture of the hymen. When a virgin is placed lithotomy position with legs wide apart, the vagina remains closed and only the edges of labia minora are seen, slightly protruding from between